Once you turn 80, one of the most noticeable changes is the gradual loss of muscle strength and mobility. This isn't just a random occurrence, it's the natural result of a process called sarcopenia, which is the age-related loss of muscle mass. Starting as early as the 40s, people lose a small percentage of muscle each decade, but after 80, the decline becomes more pronounced. This means the muscles that once allowed you to lift heavy objects, walk briskly, or climb stairs without thinking now work less efficiently. Muscle fibers shrink and lose their elasticity, which affects not just strength, but also coordination and balance. For example, tasks like standing up from a chair, getting out of bed, or even carrying groceries can feel heavier and slower. The joints also contribute to this decline. Over years of use, cartilage wears down and arthritis can develop, causing stiffness and discomfort. Combined with weaker muscles, this creates a double challenge for mobility. Another factor is the nervous system. As we age, the communication between the brain and muscles becomes slower, making movements less precise and reaction times longer. This can increase the risk of falls and injuries, which are especially dangerous in the elderly because of slower healing and the possibility of complications like hip fractures. The decline in mobility also affects independence. Many people in their 80s notice they can't walk as far or as quickly as they used to. Some start relying on canes, walkers, or other aids. While these tools are helpful, they also highlight that the body's ability to move freely has changed. Reduced mobility can lead to less social interaction, fewer outdoor activities, and even emotional effects like frustration or sadness. However, the decline isn't entirely inevitable or irreversible. In all aspects, regular strength training and low-impact exercises such as walking, swimming, or Tai Chi can help maintain muscle mass and keep joints flexible. Proper nutrition also plays a big role. Getting enough protein, vitamin D, and calcium supports muscle and bone health. Even light daily activities like gardening, stretching, or gentle yoga can slow down the decline and keep mobility better for longer. Another important aspect is preventing the use it or lose it effect. If older adults stop moving due to pain, illness, or fear of falling, muscle loss accelerates. That's why healthcare providers often encourage safe, supervised exercise programs for seniors. In fact, studies show that even people in their 90s can improve strength with the right kind of training. In summary, slower muscle strength and mobility decline after 80 is a combination of muscle mass loss, joint wear, slower nerve signals, and reduced flexibility. While aging makes some decline unavoidable, staying active, eating well, and keeping joints healthy can significantly slow the process, allowing older adults to maintain independence and a higher quality of life. The key is consistent movement, because every step, stretch, and lift counts. By the time a person reaches 80, changes in memory and thinking speed become more noticeable, even in those who remain mentally sharp. This is largely due to the natural aging process of the brain. Over time, the brain shrinks slightly in volume, especially in areas linked to memory and learning, such as the hippocampus. Nerve cells, neurons, may also lose some of their connections, slowing down the brain's ability to process and retrieve information. One of the most common signs is short-term memory lapses. You might find yourself forgetting where you placed your glasses, struggling to recall a word in conversation, or briefly blanking on someone's name before it comes back to you. These moments can be frustrating but are often a normal part of aging and not necessarily a sign of dementia. What's happening is that the brain's information retrieval system works more slowly, so recall takes a bit longer. Slower thinking, or cognitive processing speed decline, is another common change. Tasks that once felt quick and automatic, like doing mental arithmetic, following multi-step instructions, or making split-second decisions, can take more time. This doesn't mean intelligence disappears. Rather, it's like a computer that now takes a few extra seconds to load files. These changes can be influenced by other age-related factors. Reduced blood flow to the brain, which often happens with aging arteries, can impact cognitive performance. Sensory changes, such as poor vision or hearing, may also affect how quickly information is processed because the brain has to work harder to interpret input. Additionally, sleep quality often worsens in older age, and poor sleep is linked to memory and concentration difficulties. While some cognitive slowdown is expected, Certain lifestyle habits can make a big difference in maintaining mental sharpness. Engaging in brain-challenging activities like puzzles, reading, learning new skills, or playing memory games can strengthen neural connections. Physical exercise also benefits the brain by improving blood circulation and stimulating growth factors that support neuron health. Social interaction is another powerful protector. Conversations and shared activities keep the mind engaged and stimulated. Nutrition plays a role too. Diets rich in omega-3 fatty acids, antioxidants, and vitamins, especially B vitamins, support brain health. Conversely, high sugar intake, poor diet, smoking, and excessive alcohol can accelerate cognitive decline. Managing chronic conditions like high blood pressure, diabetes, and cholesterol is also crucial, as these can damage blood vessels in the brain. Importantly, not all memory issues at 80 are harmless. Significant, persistent memory loss, confusion, or difficulty performing daily tasks may be early signs of conditions like Alzheimer's disease or other dementias, which require medical attention. In short, noticeable memory lapses and slower thinking after 80 are the brain's way of adapting to natural aging changes. While you can't completely stop the process, staying mentally active, physically fit, socially connected, and well-nourished can help preserve cognitive function, keeping your mind sharper for longer. Once you reach 80, the immune system doesn't function with the same strength and efficiency it once did. This natural decline is known as immunosenescence, and it's one of the key reasons older adults become more vulnerable to infections, slower healing, and complications from illnesses. The immune system works by detecting and fighting harmful bacteria, viruses, and other pathogens. Over time, however, several changes occur that weaken its performance. The production of white blood cells, especially T cells, which fight infections, decreases. The remaining immune cells may not respond as quickly or effectively, meaning it can take longer for the body to recognize and attack threats. This is why even common colds or the flu can hit harder and last longer in someone over 80 compared to a younger adult. Another factor is the reduced effectiveness of vaccines. While older adults can still benefit from vaccinations, their immune system may not produce as strong or lasting an antibody response. This is why doctors often recommend high-dose or specially formulated vaccines for seniors, such as the stronger flu shot or pneumonia vaccine. Chronic inflammation also plays a role. As we age, the immune system can become imbalanced, leading to low-grade, persistent inflammation, a condition sometimes called This ongoing inflammation doesn't just increase the risk of infections, it's also linked to heart disease, diabetes, arthritis, and even some cancers. Weakened immunity also affects wound healing. Cuts, bruises, or surgical incisions may take longer to recover because the cells responsible for repairing tissue work more slowly. Similarly, recovering from major illnesses like pneumonia or surgery can take significantly more time, and complications are more common. Lifestyle and health conditions can further weaken immunity. Poor nutrition, lack of exercise, unmanaged stress, smoking, excessive alcohol use, and chronic diseases like diabetes or kidney disease can all put extra strain on the immune system. This is why older adults are encouraged to adopt healthier habits even in later years. It's never too late to give the immune system a boost. Some ways to strengthen immunity at 80 include balanced nutrition with adequate protein, vitamins especially C, D, and E, and minerals like zinc and selenium, regular physical activity to improve circulation and immune cell movement, good sleep habits since deep sleep supports immune repair and response, stress management as chronic stress can suppress immune function, staying hydrated, which supports all bodily systems, including immunity. It's also important to avoid unnecessary exposure to illness, such as staying away from crowded places during flu season, practicing good hand hygiene, and keeping up with recommended vaccinations. In summary, a weakened immune system after 80 is a natural part of aging, but it doesn't mean you're defenseless. With the right preventive care, nutrition, and lifestyle choices, it's possible to help your immune system stay resilient, allowing you to better fight off illness and enjoy a healthier, more active life in your later years. By the age of 80, most people notice a significant decline in vision quality, even if they have enjoyed good eyesight throughout life. This is because the eyes, like the rest of the body, undergo natural aging changes that affect how well they function. The lenses inside the eyes become less flexible and less clear. The retina may lose sensitivity, and the overall ability to focus sharply decreases. One of the most common age-related changes is presbyopia, the gradual loss of the eye's ability to focus on nearby objects. While presbyopia usually begins, once a person reaches 80, a noticeable change in daily energy levels often becomes part of life. Tasks that once felt easy, like walking a few blocks, gardening for an hour, or attending a long social gathering, can now leave a person feeling unusually tired. This isn't just laziness or lack of motivation. It's the body's natural way of signaling that it needs more rest and recovery time. There are several reasons behind increased fatigue in older adults. First, the heart and lungs may not work as efficiently as they once did. Over time, the heart muscle can become slightly less elastic, and blood vessels may stiffen, making it harder for blood to flow freely. The lungs may also lose some elasticity, reducing oxygen intake. Together, these changes mean the body delivers less oxygen and nutrients to muscles and tissues, which contributes to a drop in stamina. Muscle loss, or sarcopenia, also plays a role. Weaker muscles require more effort to perform the same activities, meaning the body uses up energy faster. Additionally, the body's metabolism slows with age, so energy production becomes less efficient. Fatigue can also be linked to poor sleep quality, which is common in older adults. Sleep patterns often change with age. Deep, restorative sleep phases may become shorter, and nighttime awakenings may be more frequent due to discomfort, medical conditions, or the need to use the bathroom. Without proper rest, the body struggles to recharge fully, leading to ongoing tiredness. Medical conditions often present in the 80s, such as heart disease, diabetes, thyroid problems, arthritis, or chronic respiratory illnesses, can also drain energy. Some medications used to treat these conditions may have fatigue as a side effect. Emotional factors, like depression, loneliness, or anxiety, can further sap motivation and energy. Despite these changes, fatigue and reduced stamina don't mean life has to slow to a complete stop. The key is energy management. This means pacing activities, taking short breaks during physical tasks, and prioritizing the most important daily activities. Short bursts of gentle exercise, like walking, stretching, or light strength training, can actually improve stamina over time by strengthening muscles and boosting circulation. Nutrition is also crucial. A balanced diet with adequate protein, whole grains, fruits, and vegetables helps fuel the body. Staying hydrated is equally important, as even mild dehydration can cause fatigue. Limiting excessive sugar and processed foods can prevent energy spikes followed by crashes. Mental engagement can help too. Participating in hobbies, social events, or volunteer work can provide a sense of purpose that lifts energy levels. On the other hand, prolonged inactivity can create a cycle where low energy leads to less activity, which in turn weakens the body further. In summary, increased fatigue and reduced stamina after 80 are the result of changes in cardiovascular function, muscle mass, metabolism, sleep quality, and overall health. While some decline is inevitable, the right combination of physical activity, good nutrition, adequate rest, and mental engagement can help older adults maintain more energy, allowing them to continue enjoying life's daily moments with vitality and purpose. After the age of 80, one of the most significant health concerns is the increased risk of balance problems, which can lead to falls. Falls are not only common in older adults but also one of the leading causes of injury, loss of independence, and even mortality in this age group. While they might seem like simple accidents, falls in later life are often the result of multiple age-related changes working together. One major factor is muscle weakness. As muscle mass declines with age, sarcopenia, the legs, core, and back lose the strength needed to keep the body stable. Weakness in these muscle groups reduces the ability to make quick corrective movements if balance is lost. Alongside this, joint stiffness and arthritis can limit movement range, making it harder to step, turn, or adjust posture smoothly. The sensory systems that control balance also weaken with age. Vision deteriorates, which affects depth perception and the ability to judge distances or obstacles. The inner ear, which contains the vestibular system responsible for balance, can lose function over time, causing dizziness or unsteadiness. Additionally, nerve endings in the feet and legs may become less sensitive due to aging or conditions like peripheral neuropathy, reducing awareness of foot position and movement. Slower reflexes add another challenge. If an older adult trips or slips, their reaction time may be too slow to prevent a fall. Medical conditions such as Parkinson's disease, stroke, diabetes, or even long-term use of certain medications like sedatives or blood pressure drugs can further impair balance. The consequences of falls can be severe. Fractures. Hip fractures often require surgery and lengthy recovery, which can lead to further muscle loss and reduced independence. Even if no major injury occurs, the psychological impact can be significant. Many older adults develop a fear of falling, which leads them to move less and avoid activities. Unfortunately, reduced activity leads to weaker muscles and poorer balance, creating a dangerous cycle. Prevention is key. Regular balance training through activities like Tai Chi, gentle yoga, or specific physical therapy exercises can strengthen muscles and improve coordination. Strength training for the legs and core is especially important. Walking aids like canes or walkers can provide stability, but they should be properly fitted to avoid creating new risks. Home safety also plays a huge role in fall prevention. This includes removing loose rugs, ensuring good lighting, installing grab bars in bathrooms, and keeping walkways clear of clutter. Wearing supportive, non-slip footwear is another simple but effective step. Good eye and ear health is equally important. Regular eye exams, appropriate eyewear, and hearing checks can help maintain the sensory input needed for balance. Staying physically active overall, not just focusing on balance, helps maintain the agility and confidence needed to move safely. In summary, greater risk of balance problems and falls after 80 comes from a mix of muscle weakness, sensory decline, slower reflexes, and medical conditions. While some changes are inevitable, regular exercise, home modifications, and medical care can greatly reduce the risk, helping older adults maintain mobility, safety, and independence for as long as possible. Once a person reaches 80, changes in appetite and digestion often become a common part of daily life. These changes can be subtle or more pronounced, and they result from a combination of physiological, sensory, and lifestyle factors that accompany aging. One of the most noticeable changes is a reduction in appetite. Older adults may feel full more quickly or simply not experience the same hunger signals they did in younger years. This can be due to hormonal changes such as lower levels of ghrelin, hunger hormone, and slower digestion, which keeps food in the stomach longer and delays the feeling of hunger returning. Additionally, the metabolic rate declines with age, so the body requires fewer calories to maintain weight, naturally lowering appetite. The sense of taste and smell also diminishes over time. Since these senses play a major role in stimulating appetite, food may seem less flavorful, reducing interest in eating. For some, this can lead to skipping meals or eating smaller portions, which might not provide enough essential nutrients. Digestion itself also slows with age. The production of digestive enzymes and stomach acid often decreases, making it harder for the body to break down and absorb certain nutrients, especially vitamin B12, calcium, and iron. This can contribute to nutritional deficiencies if the diet is not adjusted to meet changing needs. Additionally, conditions such as constipation become more common due to slower bowel movement, reduced physical activity, and lower water intake. Dental health can also affect eating habits. Missing teeth, ill-fitting dentures, or gum problems may make chewing difficult, causing older adults to avoid certain foods, especially fibrous fruits, vegetables, or meats that are important for a balanced diet. In some cases, swallowing difficulties, dysphagia may develop, requiring modifications to food texture. Medications also play a role. Many older adults take daily medications for various conditions, and some of these can reduce appetite, alter taste, or cause nausea and digestive discomfort, combined with existing changes in the digestive system. This can make maintaining healthy eating habits more challenging. Psychological and social factors shouldn't be overlooked. Eating alone, which is common in later life due to loss of a spouse or reduced mobility, can decrease motivation to prepare and enjoy meals. Emotional factors like depression, grief, or anxiety can also affect both appetite and digestion. To manage these changes, Older adults can focus on nutrient-dense meals that provide maximum nutrition in smaller portions. This includes foods rich in protein, healthy fats, vitamins, and minerals. Adding herbs and spices can enhance flavor without relying on excess salt or sugar. Staying hydrated is essential for digestion, as dehydration can worsen constipation and reduce overall well-being. Gentle physical activity, like walking or stretching, can help stimulate appetite and improve digestive function. Eating with others, when possible, also boosts enjoyment of meals and encourages regular eating habits. In summary, changes in appetite and digestion after AD result from hormonal shifts, slower metabolism, sensory decline, dental issues, and medical or emotional factors. While these changes are a natural part of aging, mindful eating habits, social